This is the last of our happy hours of this current series. Hasn't time flown by since we kicked these off, I think, back at the end of April, early May. Not only that, this is our 95th happy hour that we've held since the lockdown pandemic. How time flies, as I say. We kicked these off to replace our regional network meeting, and they very quickly become very successful and popular, and we've managed to as I said, hold 95 to date, drawing attention to really important research, policy development, practice, and innovations across housing, health and social care. And our final session is no exception. This is actually the second of two parts, a series that we've run this month. And we're delighted to have a fantastic cast for you again this afternoon to look at issues impacting on all aspects of ageing well, creating those healthy homes and healthier neighbourhoods. We also are delighted to be linked in today with P+HS architects, and Katie in particular, celebrating not only your 40th anniversary as a practice, but also your support of the LIN. And we're also grateful for UKRI for their support of our Happy Hour series. But before I pass over to our first speaker, Faye Sanders, who's a doctoral researcher at the University of Bath, we've got a King's Speech due tomorrow. And, you know, under a new Labour government, there's likely to be up to about 35 bills put forward to Parliament in this current term, of which issues relating to the care and support of all people, indeed, both within a housing environment and within regard to the NHS or care, will be, I'm sure, quite relevant, in particular from a house building perspective, with the likelihood of an announcement of a house building bill that's been trailed. Now, I'm sure that issues relating to age-friendly communities, healthy homes, won't be explicitly referenced in that house building legislation and the proposed legislation. But here's an opportunity to hear how many of us are already working closely in sort of informing and influencing not just that agenda nationally, but also locally. So we've got Faye, who's going to talk about her research, looking at issues in relation to mental health and well-being, probably a little bit more spatially. Sinead, looking at the work that Surrey County Council are leading on in terms of housing with care. Katie, you're going to draw on some examples, exemplary practice and developments that you've been highlighting and working and championing with your partners. And we're also going to draw on some research with Alison Pooley around the work of the ARC, the Almshouse Resilient Communities, looking at an issue that's really close to the HousingLIN's heart, a project funded by Dunhill Medical Trust. Well, you haven't come here to hear me speak. I'm going to immediately pass over to Faye and introduce you to Faye Sanders, University of Bath, and also, I'm delighted to say, a member of the HousingLIN's Future Leaders Programme. So, Faye, over to you.
Thank you very much for that introduction. So today I'm going to be talking about our project titled The Home and Epigenome that we conducted at the University of Bath, where we looked at associations between poor housing quality and depressive symptoms and how that was actually partly explained by changes to our DNA. I'd like to definitely thank my collaborators on this project at the University of Bath and also at Harvard Medical School and UE in Bristol. So to give a kind of brief background into the research study, this I'm sure won't be a surprise to many of you here today, but the estimated annual cost of mental health in the UK is currently £118 million. And this is likely, as you can imagine, to be a huge underestimation because it's actually very difficult to estimate these kinds of costs. And kind of just over a quarter of UK young people live in what we actually would consider to be poor quality housing. So, you know, these are not kind of minority figures by any means. And it has actually been found that experiencing poor housing quality can explain kind of greater variance in our mental health than factors that we might have traditionally associated or kind of placed more emphasis on, like, for example, income or specific stressful life events. And I want to talk about this concept of DNA methylation. And I just kind of want to explain a little bit, very briefly, what it actually means. So we are born with a set of genes that stay with us throughout our whole lifetime. But it's the expression of those genes which change. And one kind of biological control mechanism that has some kind of influence whether our genes get expressed or not is epigenetics. And that can refer to kind of little groups of methyl groups attaching to our DNA and basically turning genes on or off, you might have heard. And as a psychologist, you might be thinking, well, why are you interested in this? Well, it can influence, depending on whether those genes are involved in pathways of mental health, they can have an influence on mental health outcomes, which is what we're particularly interested in. So we came up with these research questions. First of all, can housing quality predict depression? Whilst we control for some key other variables, which I'll explain a little bit about later on. And secondly, is DNA methylation able to explain some of these associations? And we have a great resource that we use, which is I would say particularly unique in the world of research in terms of the fact that it has a huge amount of data on housing, as well as data on health. So we tested it in around 9,000 mothers, and it's the Avon longitudinal study of parents and children. So it's based kind of in the southwest of England. And it's a longitudinal study, so it's been going on for some time now, but this is kind of some of the key facts and figures associated with the sample. Now, personally, for me, I think something that I found particularly interesting in this study was actually how housing quality gets measured. So thankfully, we had a really kind of broad measure of housing variables that we could use in our study. And these kind of included things like housing size, facilities, and temperature. But they also included things like damp, condensation, and mold, so some of those more negative aspects. And these were measured kind of in a variety of different locations throughout the home, and also over a period of time. So they were collected around 3 times, roughly a year apart. Now, some of those other variables I was talking about before refer to some of our control variables. And they included things like how frequently people moved home and the quality of their neighbourhood. That might include, for example, crime, but it also might include the aesthetics of the neighbourhood. We also included things like history, familial history of mental health, and also a contextual risk score, which measured things like income, employment, education, and critically kind of baseline depressive symptoms. So this was kind of depressive symptoms measured before we constructed our models, so kind of previous history of depression. And we kind of tested these relationships in a series of different timeframes. So the first thing we were interested in was whether poor housing quality was able to predict depression measured at that same time point. And then we repeated that 3 times. And we saw that indeed poor housing quality did predict depressive symptoms at each time point. Then we wanted to push it a little bit further. So was poor housing quality able to predict depressive symptoms later on in life at 2 different time points? So, does it predict depressive symptoms 3 years later and then 18 years later? And again, we found that both of these associations appeared to be present. And then lastly, what we were interested in was whether DNA methylation was able to kind of partly explain some of these associations. And we found that kind of in the model where we're looking at depressive symptoms measured 3 years later, we found that kind of 10 sites along the genome were able to partly explain that association, which was a huge finding for us and something which a lot of people have been quite shocked by since. So some of the key takeaways of this particular study was that we found poor housing quality did associate with depressive symptoms across adulthood at multiple different kind of timescales. So whether that's current depressive symptoms or whether that's 18 years down the line. And we also found that kind of DNA methylation as part of our DNA that controls gene expression did partly explain this association in early adulthood. So I wanted to talk about some of the future kind of other works that we've been doing. And one which is of particular interest, I think, is this article about how housing can impact the rate at which we age biologically. So this was a very interesting article, which you can kind of, read some more information on. I'm also more than happy to answer any questions on that. And leading on from this, so I'm currently doing my PhD at the University of Bath, and a lot of my previous research has focused on obviously the interiors of housing and interior housing quality. But what I really want to move towards is actually housing in that broader urban context. And so I'm going to be looking at how the location of housing, so where is the house located and what does it have access to, how that can influence both our health and also mobility behaviour, so sustainable transport choices, for example. And that kind of concludes my talk today. If anyone has any questions, like was discussed previously, please put these in the chat. But also, if you have any questions or follow-ups, please feel free to reach out to me on any of those kind of platforms linked below. So thanks very much for listening, and I hope you found it interesting.
Oh, Faye, thanks very much, and that was really interesting, and also having to think about it from the DNA perspective, I think introduces a new aspect, and first from a personal perspective, but also how it reinforces how we think about psychologically informed environments as well, both in terms of people's current moves as well as future moves. There are a couple of questions in the chat box. We'll ask people to post those over into the Q&A box, or Sally behind the scenes will assist with that. But I do know that George has highlighted something which suggests that the amount that you set was an underrepresentation of the figure, and he thinks it's more like billions than millions. And I know that he's helpfully posted a link as well. So please do have a look at that, and we may come back to thinking about it, especially bearing in mind that it is mooted that tomorrow there will be a mental health bill as well as part of the King's speech, thinking about sort of issues more from a treatment and clinical model. But I think what you've done is introduced a really important take around how the built environment responds and how our homes and communities need to be much more informed as well. So for now, can I thank you very much? And can we move on? And I believe we're moving on to Sinead now, who's going to give us a slightly different take from a local government perspective. And Sinead Mooney is the cabinet member, it says here very handily, at Surrey County Council for Adult Social Care and Housing. So putting that integration in the coalface and making it real across Surrey. So welcome, Sinead, and can I also thank you for your recent blog for the LIN, and I'm sure Sally will post Faye's recent blog for us too. So over to you, Sinead.
Thank you very much, Gary. I'm really pleased to be here to be talking about the work that we're doing at Surrey County Council. So if we just move on to the first slide, and I'd like to start here really. We have 4 priority objectives at Surrey County Council, and those 4 are listed here and quite straightforward. And it is accepted within Surrey that housing sits across all 4 of those priority objectives. And the guiding mission that sits behind all that we do is that nobody is left behind. And just to give everybody some context, this guiding mission was a way in which Surrey County Council wants to tackle inequality and make sure that none of our residents are indeed left behind. And the purpose really of this community vision is that it's in place by 2030. It was jointly created with residents and our communities and also our partners. And it sets out exactly how we all want Surrey to be by 2030. So that's just to give you a bit of context around our priority areas. Next slide, please. Thank you. So again, just a bit more context, just drilling down really into housing and health outcomes with our Surrey residents. So affordability and supply of accommodation in Surrey is a real issue. Not only does it impact the quality of life and health outcomes and well-being of our residents, but it's also a huge barrier when it comes to attracting and retaining a really strong workforce. That's a real impact for those sectors with ageing populations or working with vulnerable residents across the county. That kind of covers social workers, healthcare assistants, doctors within the NHS setting, teachers as well, blue light workers. So we have some real challenges in those key areas. So we kind of shook ourselves up and decided, you know, we really want to do something about this. And sitting quite comfortably alongside that agenda, we also focused on our accommodation for older people and vulnerable residents. So given the importance that we recognised within Surrey County Council, we appointed Inner Circle Consulting, and they helped us develop our Surrey Accommodation House and Home Strategy. And that really all came to the forefront in the Housing Summit, where we had multiple partners there, all committed and signed up to this strategy and really driving forward change within the county setting, but also pushing at national level as well. So we could go to the next slide, please. So here's the conclusions, and you know, this is nothing new to anybody on this call, I know, but there is a housing crisis in Surrey, and affordability is a real critical issue. The average house prices within the county are higher than the national and South East averages, and people that come and work for us within Surrey settings tell us that they cannot afford to rent properties or to purchase properties as well. It's also become more unaffordable more quickly, rising 50% since 2011, and we've got a comparator there across South East England. So, as I say, recommendations were made for local and national action. Next slide, please. So this slide here really just talks about the challenges, the high demand, the limited supply. Again, nothing new here for many of you on this call, but we really have an ageing population and there is a big lack of suitable accommodation to particularly promote independent living. There's also limited supply of affordable accommodation, and there's a huge strain then on our public services and impacts as well around homelessness rates and our looked after children and care leavers as well. There's lots of land available for residential development, but a lot of it is greenbelt, so that becomes really restrictive. And there's quite a bit of housing stock across the county with various providers, but it really is quite old and it does need significant improvement to make it more efficient and suitable. Thank you. So the recommendations here are at a local level, a Surrey-wide level, if you like, to strengthen our partnership arrangements, to be constantly sharing best practice. Each stakeholder and partner does have a regular kind of session in which they can share an update around best practice. And it's really important that we really focus on that and keep that momentum going. Providing appropriate accommodation for older people, a little bit more coming on that in the next slide. And we're looking really closely around step-down housing, temporary housing as well, with a real focus on social rent. We formed a really good connection with Homes England, and that's really going to be extremely positive when it comes to moving forwards with our ambitious plan around developments. More on that very shortly. And that investment to retrofit, I think that's really important. Some of us may have missed some opportunities there. I think we need to get that back on the agenda as a high profile item. But in the green boxes, you'll see our call to government, greater powers to speed up development. There's a real sense of frustration there in this particular area with our stakeholders and partners. And we have written and asked that there are steps taken to speed this up. Lots of inconsistency. We need real certainty in the planning system. It does take some time to get those approvals in to move forwards with your developments, and that's frustrating. Support for regeneration, funding for retrofit, and greater power over land assembly. So we came across a couple of examples within Surrey where there were real challenges around releasing land, particularly with multiple partners involved, and that becomes very clunky and slow. We want to work through those barriers. Next slide, please. So I'm conscious of time, so just to tell you briefly what we're doing within Surrey. We are developing 1,400 units of specialist accommodation. We're moving away from the institutionalised residential care settings to that really important specialist accommodation through big investment in extra care and supported independent living. So some main headlines here are we're delivering 725 new units of affordable extra care housing by 2030, and we're well on our way to delivering that. And providing 500 supported independent living units for people with learning disability and autism, and also mental health needs as well, additional figures there. So the next slide just gives you a taster really of what we've got coming. So the Right Homes, Right Support programme is progressing really well. We have the extra care housing being built on council-owned land. So I think that's really important when making best use of our assets and our facilities. We have sites with planning permission, a bit of an update from this slide, and construction starting shortly, and a further 6 sites with outline planning permission. So there's a lot going on. My biggest challenge, I think, will be around all of these schemes coming live at the same time. A real issue for us. So just a design there really for Salisbury Road, 93 units of extra care housing, and Bentley, 53 units of extra care housing there. We're very proud of what we're doing in Surrey. Our residents are really excited about this. They're inquiring all the time about how they can move into one of these schemes. And we're well on our way to building and delivering these and making this a reality. Thank you very much, Jeremy.
Well, and thank you, Sinead. And that was really illuminating, both at a strategic level, how you're positioning yourselves to really have a market penetration around a broad supply, as well as ending with some really great examples of healthier homes and healthier neighbourhoods, including day opportunities, day centre. I think there was a Bentley Road, Bentley as well. So that was great. I'm also old enough to recall that when I worked for Anchor, I think a number of the care homes were moved over as part of the PFI, and those are probably coming back to you, and you've got some opportunities about reinvesting and looking at the land availability for some of those sites as well, which might also help the development programme that you referred to.
Absolutely, Gary. We've got the final tranche of those homes returning to us 2027, some 2028. And we're looking at plans right now, actually, as to what happens with those buildings and those locations and sites. It's going to be an exciting time, so do keep an eye on us and what we're doing at Surrey. We should know more about that later this year. Thank you.
No, definitely. We look forward to working with you and following you over the coming months. You touched on in your final slide some of those designs. They look very HAPPI-esque, and that's a good link over to Katie, because the work at P+HS includes a recent HAPPI award-winning scheme. And so, Katie, thanks very much, both the company's support of the LIN, but also we're really looking forward to hearing some of the exemplary examples that you've been working on and your thoughts about taking those forward.
Thanks ever so much, Jeremy, and thank you for all the interesting presentations so far. So for those who aren't familiar with us, as Jeremy mentioned in the introduction, P+HS are an architectural practice of 105 people across 4 offices, and we are currently celebrating our 40th year and have a breadth of experience in sectors such as residential, healthcare and adult social care. The values of our practice are purposely aligned with the socially focused beliefs of our clients, which in turn allows us to provide social impact through architectural innovations. Our passion lies in creating spaces that enhance people's lives, and today I'm going to reflect on the social benefit that good design can bring in partnership with clients who serve those most in need. So the key topics I'm looking to explore are identifying how various care, support and NHF health bodies can create an inclusive and targeted environment centred around adult social care, outlining the key design principles implemented to successfully deliver an attractive and inclusive environment, and champion the use of outdoor spaces to stimulate physical activity and in turn tackle physical and mental conditions, ultimately celebrating the importance of the in-between and how these spaces are pivotal in creating community-orientated developments. So, what is the in-between? So when we start on any collaborative design process, as designers, we need to ensure we fully capture a client's ambitions and articulate the key elements that will give the client and the communities they serve the success factors that they require. We do this by drilling into the brief and agreeing on a set of key design principles that can be continually benchmarked against as the scheme progresses. The ones on the screen were developed for an innovative ageing well village, which I'm going to use as a case study throughout. It was an ambitious care and support scheme for later living, and the design brings together various client groups to form a bespoke environment where people can live well into older age with a variety of accommodation types and on-site support. As you can see, several of the design principles developed centred around the in-between spaces that help to orchestrate incidental meetings, which are of paramount importance when developing a fully integrated care and support scheme. Careful consideration of what factors influence health and happiness and what amenities could be incorporated within the neighbourhood to support rather than diminish mental and physical well-being should always be central to any concept. As such, allowing these principles to inform the site and landscaping, which can be carefully chosen to create a space that is safe and pleasant to live in, with good links to local facilities and access to green spaces, can enhance user experience exponentially. So how do we do this? So following on from the development of the key design principles, we work with all of our clients to fully understand the development's brief and the schedule of accommodation. The image on screen shows a typical adjacency diagram, which we produce to ensure that all spatial relationships are captured. It also allows us the opportunity to challenge the brief against the key design principles and ensure that the scheme hits these targets whilst also allowing for an economic use of space. So in the example, it illustrates how the in-between can be created even in the early stages of development. In this instance, the proposal included multiple building typologies, which needed to be intrinsically linked. We challenged the client to share a larger amount of accommodation than originally anticipated, and this allowed us to create the central route, which sits at the centre of that illustration. It created a space that all users would inhabit day to day for a variety of reasons, again embedding the principles around incidental meetings. And it also helped us to evolve the big ideas for the site, which became centred around active environments and using landscape as a tool for enriching physical and mental health. And then we started to take this a step further. So user stories is a mechanism that we use throughout a lot of our schemes. It's a natural evolution of the adjacency diagram, and it develops a deep understanding of the site users. We work closely with key stakeholders to develop a series of user group diagrams and character stories to illustrate how a day in the life might look for a resident, a visitor, or various staff groups. The inclusion of care and support facilities can usually help to create a vibrant hub with various groups we'll be travelling to from around the community. And it also gives an insight into user experience of the site. For the example shown, we work with the stakeholders to start and map out the different user groups and how they would travel through the spaces. And then this moved into a more in-depth analysis as the design became more refined, and was really a really helpful tool when engaging with stakeholders, as it helped us all to map out an individual's journey and the challenges that they might face when accessing the site, which in turn helped us to develop a design and initiatives which would mitigate against these. In the example shown, we had various user groups weaving their way through spaces that we wanted to maximise every opportunity to access the services provider and the wider community. So in this instance, the routes that we followed included Bill, who was a care hub patient. We had Dorothy as an extra care resident. Michael, in this instance, who was an Age UK employee. Alison, Richard and Lucy, who were visiting family of a resident. And local residents, Bob and Edith, who were coming to the site for some specialist advice. And this is a tool that we repeat throughout schemes, so it gives us such insight into the varying needs of our clients and the user groups that they're serving. So when we move into maximising opportunities through design, the graphics on screen illustrate how the in-between spaces can be fully integrated into the overall design, be that through the use of balconies, porch details, landscaping, resting points, village greens, the list, it goes on, and we use them a lot. The examples used throughout the presentation so far have showcased larger schemes, but in our experience, these design principles can be applied no matter the size of the development. We work with clients on a variety of sites, from schemes such as 5 bungalows on a brownfield site to extra care accommodation blocks, and all the way through to large-scale master plans. And in each instance, similar design principles can be applied. It's just the scale of the interpretation that changes, not the big idea. So for us, the use of small design interventions are often the most successful, and it can be something like a well-positioned bench as a resting point, well-designed overlooked communal spaces, low level from boundary treatments, all of which encourage behaviours and interaction with the physical environment and the surrounding community, which is usually the ultimate aim. So when we look to embed these principles, following on from the user mapping, we have an opportunity to ensure that the environment caters to the needs and requirements of each user, and in addition to creating an inclusive and targeted environment. So the image that's illustrated shows how those user routes really dictated the routes throughout the scheme, and in turn influenced the building entrance points, the scale and massing, the location of each building, and then other spaces such as balcony and terrace spaces which interact on that multi-level, creating an environment that was free-flowing and linked each building type with the central route, going back to that adjacency diagram right at the start, which sat at the heart of the site, and in this case ultimately became a central hub. So it was a building in itself which all routes were connected to. And the evolution of those user journeys, which we were ultimately able to showcase through the thought and consideration that had gone into the scheme through a single residence journey for the completed design. So as you can see from the images on screen, their daily journey touched on each service and support element provided throughout the site. So be that views from her home to the communal spaces that could be accessed within the extra care building, through to the various support and wider community elements available, giving space for initiatives such as knit and natter, men's sheds, rehabilitation within the landscape, local facilities, just to name a few. So all of these design innovations have purpose and link back to what the requirements of the client are. And I think just to round off, this is showcased in the final site plan, which is the illustration on screen now. And as you can see, the in-between spaces that sit between the buildings offers the most opportunity when creating an active environment through the use of landscaping, pedestrian routes and navigational nodes. So in this instance, the design principles evolved from the initial big ideas that I shared right at the beginning to include an emphasis on creating a healthy built environment which aids and assists rehabilitation and recovery, sensitive site massing to cocoon the proposed development and surrounding context, green fingers to provide an interactive leisure zones within the heart of the development, the integration of all building typologies to create a healthy lifestyle and recovery hub, easy access to green spaces, local facilities and transport links, and ultimately an integrated usable landscape and communal garden spaces, which were really key. Thank you.
Katie, thanks very much for a wonderful presentation. I think what you've demonstrated there is not just the physical architecture, it's the broader social architecture that also has an importance to our health and well-being. And the fact that you talk about things like street furniture, intergenerational living. I know that one of our partners here is the UKRI Healthy Aging Challenge, and they've invested a lot in thinking about place-based initiatives, which can demonstrate ways to reduce and tackle loneliness, for example, right through to creating more opportunities for physical activity. And I think the examples that you've given demonstrate that, both in terms of locality as well as in terms of individual developments that you've been working so closely on and seeing coming to fruition. So, Katie, thank you very much for that. And I suppose the segue here to Alison is about how to build those resilient communities. And Alison has been leading the light with a number of partners on thinking about this in relation to almshouse provision. So I'm going to share, I'll ask Alison to share her screen and kick us off on a final presentation on the ARC project. So over to you, Alison, and thanks very much for joining us this afternoon. You may be muted.
Yep, no, I'm not. I'm unmuted now. Okay. Yeah, thanks everyone. Yeah, so I'm going to talk about the Almshouse Resilient Communities project, Almshouse Resilient Communities for the Future. Yes, my name's Alison Pooley, as Jeremy said. I'm an associate professor at the Suffolk Sustainability Institute, which is part of the University of Suffolk. So this project was sorry, I'm just going to get rid of some of these. I've got silly things floating around in front of me. Yeah, so this project was funded by the Dunhill Medical Trust and led by UCL, and with the University of Suffolk, and with critically with these 7 charity partners, 7 almshouse charity partners. And so the Arc for the Future project, the main research question was, how can almshouse communities become more resilient? And we were looking at this in terms of community as past, present, both governance buildings, the grounds, the staff and trustees, so the whole community. And we were using this quote here to guide our thinking around resilience, and specifically looking at resilience through these 3 different lenses: the social, the governance and the built environment. And it wasn't an evaluation as such, but we were definitely looking at what works, sort of in best practice. And through qualitative methods, we worked with about 102 residents, staff and trustees across the 7 charities, and conducted a thematic analysis, which led us to 30 themes, which clustered together under 4 overarching themes: enhancing the built environment, valuing and supporting people, focusing on the future, and developing and strengthening community. And the main output of the project was this knowledge hub, which I am hopefully going to navigate to now and do the rest of the presentation through that. Okay, that's not going to work because it didn't work when we practiced it. So I'm just going to, show my taskbar, and hopefully this will work, because I'll take you to, if people can see that, then hopefully. Jeremy, can you see that? Okay, can you see the website?
Yes, Alison.
Yeah, okay, we can see the website. Great. Okay. Yeah, so just navigate. Yeah, so this is the output. So it sits on the United St Saviour's Charities website, and they're hosting it for us. And you can see here we've got different information about the background to the project, about the partners, how to cite, and then we've scrolled down to the themes that are clustered in those 4 overarching titles, and also all the sub-themes. Or you can also navigate to themes depending on your occupation or interest in almshouses, and then further down we have case studies. So I'm just going to quickly go to look at the themes and just talk about 3 of them, and then I'm going to talk about one of the case studies. So the first theme I'd like to talk about is design and shared space, which is really perfect because it follows on beautifully from Katie's presentation. I've got these set to open up in different, you don't have to have them open up in different windows. And here in this image we can see the Appleby Blue, which is the United St Saviour's new almshouse in Southwark. So we've got every theme has got a summary, learning points for resilience, and then related themes. And you know, for us, that all of the things that Katie has just said about those in between places is really critical. Creating communal space doesn't have to be a formal lounge; it can be informal spaces, the in between spaces, the streetscape. Wider corridors. So this really came through, and obviously in what Katie was saying as well, one of those key shared spaces can be garden areas, whether that's formal green area space or courtyard. But you'll see when we go through each theme that each one also has a link to the related themes, and you can either do that through the text or go into the related themes. Which is quite handy, because the next one I want to talk about is people, place, connections. So again, you know, as we've heard through the presentations already, you know, that important connection to place, when we look at the summary here, how critical that is for connections both within the community but to the wider community as well. And you know, it picks up a little bit what Sinead was saying as well about, you know, people wanting to remain in place because they already have that attachment to place and that connection, or, you know, reconnection and making new connections to new places, perhaps through design and shared space, and being able to do it that way. So although we have these three different lenses we were looking at almshouses through, and resilience of almshouse communities, obviously they all overlap and they all interconnect, and there's a relationship between all of them. So the last theme I'd like to look at is building community, because although we're talking about community and place attachment, we also know that building community outside the organisation is really critical. And this is both for individuals within that community, but also partnering and that building those relationships. So again, as Sinead was saying, that those critical decisions about who you work with and how you work with them, and making those links to enable development, you know, could be one thing, or supporting your residents could be another way. But so the last thing I'd like to show you is the case study, which really highlights in that the importance of connections and building community outside the organisation, because the case study on Southwark is really critical, because that really demonstrates the important things that are happening in Southwark, but also the really critical relationship that Southwark Charities had. And here's our case study that Southwark Charities had with United St Saviour's Charities, all in Southwark, which has enabled, I'll go there, enabled the development that's taking place now, but also the development into the future. So Southwark have, you know, a long-term plan for providing affordable housing at social rents within Southwark, building on their 400-year history. And that's really critical, that relationship. I won't overly explain it now because I'd really like you to read it, but that critical relationship that's helping not just the charities themselves build resilience in terms of long-term planning, but also helping the residents stay connected to place and retain that place connection, retain those relationships that are all really important, which goes back, of course, across all of the presentations that we've had today, including the issues around mental health, resilience and security. So I'm going to close all of that down. Hope I'm back at the that now, and you can all see that, because there's different ways on that slide that you can connect to the project, either through the QR code or link or the URL direct. And if people have got any questions or want to contact me, my contact details are there too. So I'll stop sharing there. Thank you, Jeremy and Sally.
Oh, well, thank you, Alison. And I was struck at the grand opening of Appleby Blue. It wasn't just about the building; it was also very much about the community. and the work with Southwark Charities that you highlighted, and the way the residents also were contributing, both in terms of the stories, but also pictorially drawing and using different forms of ways of expressing and sharing their stories. So that was really
conscious of time, so I don't want to over egg it, but it is really interesting, that relationship and that you know, how that's worked. And the very interesting thing when you read the case studies, there's a little map, so you can see how far residents move from one almshouse to the next to enable the and that interesting relationship about what is local, what is community, and that sort of hyper locality as well. Yeah, so it's
yeah.
yeah.
Yeah, no, absolutely. And we look forward to the development and the ambitious plan that Southwark Charities have already in terms of their, I was going to call it a vertical almshouse. I think is probably the best way to whet people's appetites. Watch this space and read the case study, as you say. Look, it's been a fantastic session already. We've had 4 brilliant presentations, all linked. I hope you can see how we crafted this, all very interlinked around issues around health, well-being, in relation to both aging well, but also how we sort of forge ways forward to create more healthy and vibrant communities where people of all ages can thrive in. So on a personal level, can I first of all thank you for those excellent presentations. We've also got a series of questions that people have posted in the Q&A box, and I see we haven't had an opportunity to upvote them, so what I'm just going to do is just kick off and go through them one by one, if that's okay with all of you. The first is about looking at green and blue space, and I think a couple of you talked about that in relation to housing location. Katie, I think you had a drawing around that, and Sinead, I think you talked about that, thinking about sort of and especially for Sinead, I suppose, issues around the green belt is a big issue for you. So from Callum's questions, are there any particular things you'd like to draw out in response?
Yeah, perhaps if I could start, Jeremy.
Sure.
It's a really important question, actually, and we've placed a great deal of focus as we've moved forward with our plans around delivering it in locations where residents can access amenities. And we feel that's really important, particularly around the supported housing work that we're doing. So those kind of local amenities are very, very accessible within a very short distance from where we're building our supported accommodation, so people can feel part of their communities, can access really good green outdoor spaces. We're a very green county in Surrey. There's lots and lots of trees here, and there's lots of beautiful places to go to and see. So, and that's really important for our residents' well-being and health. So that green and that blue kind of question and themes is really, really important to us, as we want our residents to be mobile and really enjoy being part of their communities and what's around them, where they live as well. It's incredibly important.
And Katie, I suppose that's something that's central to you as well, in terms of thinking about the place, the location, and the broader environment, both in terms of green and blue space, but also nature in general.
Absolutely. I think they're all intrinsically linked, and it's good that we're moving away. I think there's still a little bit of a stigma around older person's housing, and people feel as if it's shut off. And that's a hurdle that we still need to overcome, because the developments that are coming forward in modern times aren't like that at all. It is looking at how that scheme enhances the area that it's in and has those links intrinsically within it, so that it is part of the wider community. As Sinead's already said, it's linking it as one, so it's just an alternative place to live, which is more in tune with the needs of those residents, because it has that access to the green spaces and facilities on the doorstep, and in a building type which is a bit easier to adapt as the requirements dictate.
Yeah. Alexandra asked a question which is probably aimed in this first instance with Sinead, which is around thinking about conflicts and some of the challenges at a statutory level between the priorities, which may be a housing priority and an adult social care priority. But I think your portfolio, Howard, that covers both. So what are your top tips for this?
Well, I've got many, but I'll just start with a couple. I mean, this housing strategy piece of work that we've done really isn't something that county councils kind of tend to do. But, you know, we wanted to bring all the partners together and felt very passionately and strongly that actually county councils do have a say in this space and can be positive and good partners to work with in this area. So my top tips would be, if there's any councillors on this call, make sure you've got a good tin hat and be resilient, because initially it's a rocky road as you kind of talk this through, particularly with key stakeholders, districts and boroughs, if you're in a two-tier authority like we are at Surrey. But you do get through that. Once every organisation understands this isn't, you know, a territorial approach, it isn't about impinging on their sovereignty and the areas that they work in, it's actually coming together and looking at what we can do collectively. That you're in a really good place then. And we've got there in Surrey, we have got there. So my next tip would be to always give that message that actually priorities in care and housing are very aligned. And I know the question particularly spoke about that. I mean, when you look at the availability of specialist accommodation and the roles that local authorities have in increasing that, then particularly for the social care setting, there's real synergies. Another tip is, you know, work really well with the officer team and make sure communications is really good. That's one of our strengths in Surrey. We've got land and property looking at the land. We've got adult social care kind of setting the strategy, and everybody's working very well together. So comms is key, tin hat initially, and then be really focused and know what you're looking to achieve right from the offset.
Thanks, Dan. That's a really honest approach. The other thing I would just add to this, Alexandra, is that for many years the departments in government working with local government association, the HousingLIN and others, have really been advocating something called a memorandum of understanding across housing, health and social care. So not just housing and social care. So do have a look at that. It's something that the LIN hosts on its website and is very keen with the incoming government to see as part of the integration agenda that this becomes a mechanism for binding some of those and having an opportunity to have a dialogue to overcome some of those conflicts. And that could be planning, it could be about the land, it could be about the revenue as well. So do have a look at that if you're not familiar with it. Duncan in Gloucester, which is close to where I live, has been asking a question which looks more broadly at supplying housing which are energy efficient. There's a question here really about service charges and what are your views about controlling service charges. Now, I'm conscious that none of you are operators, but I'm just wondering whether anybody has a view anyway on service charges and the impact on, especially bearing in mind we've got a cost of living crisis as well. Any immediate thoughts?
I can chime in with some work that we've been doing with registered providers.
Please do.
And well, we've been through this process as the building regs and the sustainability targets have been on that evolving journey. We'll see with these 2025 regs actually appear next year with the change in government, so that's one to keep an eye on. From our experience, obviously, registered providers have at the key of and social landlords at the key of what they're doing is looking to challenge and take on that cost of living crisis, and if they can do that within the sustainability elements of the fabric of the building, making sure that residents' bills are lower, ideally non-existent, then that's a way to address it. But I think the question is justified because it's a very difficult one to square off, because ultimately it's more costly to build, so there's going to have to be a way of bringing that profit back in some instance, because the product that you're putting out there is a more expensive one in the first place. It's very tricky at the moment, and I know that it's difficult for Alison's. I'll hand over to Alison because Alison probably has more experience of this than myself directly, but with grad levels what they are, it's a tricky one to square off.
Yeah. Alison, do you have a view?
Always. I wasn't going to, just as an aside actually, because as Katie was talking and particularly thinking about the cost of living crisis, of course we're always going to be pushing for energy efficient bio-based materials, healthy homes, as well as affordable homes. But and just thinking about what Octopus Energy are doing, other energy providers are available of course, but Octopus Energy and what they're doing in terms of their zero bills they're zero bills provision, so every home becomes a mini energy provider feeding back into the grid. So that's a way of reducing that sort of impact of the daily cost of living for residents. Doesn't address the service charge, but I was just thinking about service charge in terms of almshouses as well. Of course, almshouses vary in scale from, 2 or 3 in a village or town to, much larger developments. So there's not always those service charge issues, but almshouse residents don't pay rent as such. And service charges, obviously, they pay their weekly maintenance contribution. So there's a difference there. So I would always encourage people when looking to develop to think about to think about almshouses as well, and a sort of new philanthropy, because the Almshouse Association are very keen, and the King is still the patron. So even better when he makes his speech tomorrow, maybe. Yeah,
that's a good point. And there is a question further down about, in particular around Surrey, about almshouses. I'm just conscious, Faye, there aren't any direct questions for you that I can see, but do you have a view about issues around affordability, energy efficiency? You mentioned damp and mould in your presentation. It has a big impact on the mental well-being of many residents, whether they are private tenants, affordable homes, social housing tenants, or homeowners, or indeed homeless. So any thoughts?
Yeah, indeed, we're actually conducting some research at the university on fuel poverty in housing and its effects on both mental and physical health. Again, that's a huge kind of hugely difficult relationship to measure, actually. I've just seen a question in the chat directed to me about differentiating between the cause and effect for mental health from poor quality housing. And I'll just give a very quick answer to this. So controlling for baseline mental health symptoms was a key part of our models, particularly for kind of controlling for this reverse causation. So that's kind of how we accounted for that in our models. But happy to provide more details if needed.
Yeah, no, thank you, and we look forward to following up specifically on that with you. And I know that the LIN is also interested in that, so that may be a future happy hour as well. Alison, who is, I know personally from United St Saviour's and the long champion of the LIN as well, thank you for your support. How do you go about a post-occupancy evaluation of these in-between spaces? And I think that's a question for Katie. Any thoughts on that? Something I also like is the liminal space, those bumping spaces in between.
Yeah, it's something that we've been working on ourselves in line with developing our social impact policy. So what we've done is we're working on it. Well, we have implemented a social impact design toolkit, which gives us an opportunity to put in some key targets right at those initial design stages, which then feed back into the post-occupancy evaluation. I'm not going to lie, we are still working this through because we're very early on, so we're testing it out on a few schemes, but it really resonates with us. But actually it's those smaller spaces, those small interventions that usually have the biggest impact on the clients and the user groups within that. So that's how we're unpicking that. There's a few more details on our website for anybody who's interested in that, because it's been a really good journey to follow looking at that.
Well, Katie, that may be something we can engage with you about, how we can showcase that through the LIN in the coming months, and maybe a lot of people will be interested in that, especially in relation to social impact. But thanks for that. Louise asked a question around modern sheltered housing, and indeed next week sees the launch of the APPG inquiry on regenerating outdated sheltered housing. Extra care is great, but not a level of care and support all old people want or need. Is this sheltered housing still part of your offer, Sinead?
Thanks, Gary. No, we've got a plethora of registered social landlords across the county, and that is very much their domain. As I talked through on the slides, we are focusing around that support independent living, extra care housing, respite, short breaks as well. For carers. So RSLs, I think they're very much in that space. And there is progress being made across the county in that area, but not in Surrey space at this moment.
Well, I know that, I mean, there's a wealth of extra care, sheltered housing, almshouses. Sorry, the next question from Sue is, they're looking for a pipeline of extra care housing linked to the Almshouse Consortia. So I imagine Sinead is always open to have a continued conversation. But I think her question also is, how are Homes England engaged in this as well? And I imagine you and the team are having those conversations with the investment teams for Surrey.
Yes, we've gone down a slightly different model in Surrey, and happy to talk to anybody offline about this. But we have strategic partners who are kind of having those direct conversations with Homes England and are being successful in securing funding. So our model is very much around kind of leasing the land to our strategic partners who will design, build, and operate. And we get the direct allocations for our social care cases, if you like, where our real pressure is around that day-to-day operations.
Yeah, so that links very much to a planned care approach that you're taking forward as well. Yes, I can see that. We've just hit 5 o'clock. If it's okay, and you can stay on, I'm just going to take a few more questions that have been posted. So I'm going to jump a couple from Sue, because Wendy's asked one, which is again for Katie. How do you define? No, for Alison, I think she corrected herself. How do you define resilience? And is your project focused more on existing almshouse, or are you thinking more about expanding the model in terms of increasing provision?
Well, the research itself was based on based around the work of those 7 charity partners that we worked with. So all existing charities, all with existing almshouses, some with development ideas, some recent developments, some with developments in the last 10 years, and mostly all with ideas for future development. So that was that. What was the other? What was the second question? Was the
second question was around
the Wendy Twist one,
the Wendy one, about looking at existing supply as well as new supply.
Yeah, I mean, always looking at new supply, and that's the great thing about the Almshouse model, that it's been around for about 1,000 years. And there was a meeting last week, the Almshouse Association meeting, looking at those issues around new philanthropy and new philanthropists. But Jenny Pannell and I wrote a RICS report 4 years ago, which actually is on the HousingLIN website, which might be useful for going through some of these questions, might be useful for some people to look at if you haven't done already, because there are examples in there of local authorities teaming up with almshouse providers, community land trust, almshouse provision, collaboration as well, and some of those other types of models. So that might be useful. It goes into some of the mechanisms there as well about funding and some of the routes people take. Again, obviously every almshouse is different, and some not all almshouses will have access to land value, for example, as Sinead was commenting earlier. Different locations have different abilities. So yes, keep building almshouses.
Yeah, and we have your report on the LIN website. For those people that aren't aware, we have a dedicated page all on almshouses on the LIN website, and I'll ask Sally to post that in the chat box if she's got an opportune moment before we draw to a close. And
I realise I probably didn't answer the resilience question, but resilience really is, to those unexpected events and how you cope with those unexpected events arising. And we've all had those, and we will all experience those. And COVID obviously was a particular one, but even those daily bits of resilience can be challenging. Daily changes can be challenging too. So that's where that community support becomes critical.
Well, I'm going to draw this to a close just by sort of answering a question from Sue again about governance issues covered in, and whether that was covered in the Almshouse research. Again, it's probably a bit more operational because it has an implication, as she says, in terms of strategically, but also what it means in terms of affordable provision to remain compliant. And she also asked later about, issues again about the relationship with Homes England and the GLA and others about trying to access grants. I don't know if anybody on the panel has got any particular experience or knowledge of those. Alison, it probably comes to you first.
Well, I'm going to say read the website and look at the Knowledge Hub, because that's where the outputs reside. So please do look there. But obviously, yeah, I mean, the governance issue, there's obviously a governance overarching theme around governance. And there's also a case study on smaller almshouse charities as well, and compliance and governance issues that particularly for smaller almshouse charities. The majority of almshouse charities are smaller, because they have very few homes. So I would point people to there, really, in the interest of time as well. Yeah.
Okay, well, look, we've overrun by 5 or so minutes, and I hope you don't mind, both fellow contributors as well as delegates, for staying on for a few more minutes. On behalf of the HousingLIN, can I thank all of you, Alison, Faye, Katie, and Sinead, for 4 excellent presentations. It's really been a wide-ranging subject, but I think we've really pinned down to issues which are very pertinent around, not just around extra care, but also the broader range of housing choices for older people to age well and live well into later life. A big challenge that the Healthy Aging Challenge set out right at this outset around providing 5 more healthy years to people. And I think you've all demonstrated opportunities, ways to do that, from a policy, from a strategy, from research, from actually delivery, and also development as well. So thank you very much. As I said right to the outset, this is our final happy hour of the series. We are currently planning our autumn-winter programme. We very much hope to kick off towards the end of September. So I wish you all a very happy summer break from the HousingLIN. I know you probably are inundated with emails inviting you to present and speak and watch various webinars and events that we hold throughout the year. But we look forward to sharing with you a programme in the autumn and kicking off, as I said, hopefully towards the end of September. If this is the first time that you've watched a HousingLIN presentation and happy hour, we will put all the recording and the PowerPoint slides up on our website. Please do also watch out for forthcoming events. And if you want to share your own leadership, your thought leadership, your own presentations on examples of practice, do let us know. Sally and I are always interested in receiving new content so that we can populate both the website, and I'm sure Alison will also populate the ARC website and the Knowledge Hub too, where it relates to almshouses. So do keep us posted on that. Well, on behalf of the HousingLIN, can I thank everybody here? Can I thank Sally and the team behind the scenes for an excellent series right throughout this first half. And I nearly came to a footballing half. The second half will kick off in September. And again, thanks very much for staying with us, and we look forward to seeing you all soon. And finally, Katie, happy birthday to the team as well.
Thank you very much. Much appreciated.
Thanks, everyone.
Thank you all.
Bye.